As far as I know, Project Prepare is the only organization in the country that provides transgender patient educators so that students can receive immediate feedback from transgender people who have experienced the challenges of going to the doctor.
Hi, Jen.
Hi.
What brings you in today?
You know, I just recently came out as genderqueer, and that's great. But I do need some safer sex advice.
Okay, so you're transsexual. Want to let you know that I think you're very brave, and I honor that you're being true to yourself. In fact, I know a transsexual. Saw him at a clinic once. He had great hair, and he was very real.
I so don't identify as a transsexual.
Oh, you haven't had your sexual reassignment surgery yet? I know a very good doctor for that if you are still looking.
It's not about surgery for me.
The best way to really protect yourself is by putting a condom on your penis.
I don't have a penis.
So you're a woman, do you have a vagina?
I'm not a woman.
Okay. So, do you have sex with women, or men, or both?
With genderqueer people, other genderqueer people, yeah.
Okay.
During the feedback sessions, many students feel really embarrassed, and we help first reinforce what they did right, and then give them really concrete suggestions of how they can improve their skills.
I don't have any experience really, so I was trying to tell you everything I knew about transsexual people, and I think it felt like it went a little overboard.
You know what? The transparency and upfrontness that you just showed, like, if you can bring that into the encounter, that would be perfect.
So I guess for me it was really not knowing how to engage you because I don't know much about the trans thing, and it threw me off and I felt like I just froze.
You know, the biggest piece of advice I have for you is that it's okay not to know everything and to say I don't know and to ask questions.
So, you know, I'll be honest with you, I haven't worked with many genderqueer people before, but I really do want to be respectful. So can you help me out a little bit?
Of course.
Thanks. So first of all, what does genderqueer mean?
Yeah, thanks for asking. It actually means, well, for me it means that I don't identify as totally female or totally male.
Okay, great, thank you. And so what words do you use to describe your genitals?
Yeah, personally I use frontal and back wall, but lots of my friends use different terms.
Okay, well, you know, the reason I'm asking is that we just want to make sure that you're not sharing anyone else's bodily fluids, because that could increase your risk of transmission of STIs.
So for all your patients, regardless of their sexual orientation and regardless of their gender identity, what is most important in terms of risk assessment is finding out what are the sexual practices that your patients engage in. And you did a great job of starting and introducing that series of questions by telling me why you're asking that series of questions.
They leave our sessions feeling empowered, feeling supported, better about doing these kind of interviews, and ultimately that's the emotion that we want their patients to feel.